Otherwise, the weather's better here.
I hear you. And we have started recording. Thank you, Jeremy. Just waiting for more members to join. Hi, Ryan.
Hey.
Hi. We are just waiting to make quorum here. Hi, Maggie.
Hi, everyone. If you're just joining, we're just waiting on quorum. Thank you.
Just waiting for 2 more folks. Just one more person and we'll go ahead and get started. Thank you all for your patience. Okay, we have made quorum. Let's go ahead and get started. Thank you so much, Tamara.
All right. Thank you, Sarah. Hello, everybody. Welcome to the Maricopa Regional Continuum of Care Board meeting. Let's call the meeting to order. My name is Tamara Wright with Community Solutions, COC Board Co-Chair. And before we get started with attendance, I just wanted to remind everybody that the materials for this meeting are found on the website. And you can literally just Google COC mag PHX and it all comes up. So just wanted to remind you that that's where all the materials are. And now I'll have Sarah commence with roll call. If each of the board members could please introduce yourself and your organization.
Thank you so much, Tamara. We will start with Co-Chair Tamara Wright.
Hi, present. I'm with Community Solutions.
Great. And Co-Chair Ryan Balch. Ryan's on. Ryan, meeting.
Sorry about that, everyone. Hi, Ryan Balch, City of Chandler.
No worries. Hi, Ryan. Eric Cole. Eric Cole, we can't hear you. Can you unmute yourself? Eric Cole.
Hi, sorry. Hi, sorry, it's Eric Cole. Can you hear me?
Yep, we can hear you now. Thanks, great, Eric. Elizabeth DaCosta.
Hi, thank you.
Hi.
Hello, Liz DaCosta with Community Bridges.
Hi, Liz. Marshall Franklin.
Sorry about that. Marshall Franklin, City of Phoenix. Thank you.
Okay, hi, Marshall. Great. Next, Tad Gary. Okay. Samantha Jackson.
Hi, everybody. Samantha Jackson, Downtown Phoenix Partnership.
Thank you. Hi, Samantha. Bruce Liggett. Bruce Liggett. Okay, come back to that. Great. Joan Service.
Hi, Joan Service with the Arizona Housing Coalition.
Great, thank you, Joan. Charles Sullivan.
Charles Sullivan with ABC Housing.
Great, thanks, Charles. Jackie Taylor. Jackie Taylor. We'll come back to that as well. Okay. And that is everybody.
Oh, looks like Bruce Liggett just joined.
Oh, great. Hi, Bruce.
Hi, Bruce Liggett, Maricopa County.
Hi, Bruce.
Bruce.
Perfect. I'll hand it back over to you, Tamara.
All right, thank you. Just a reminder for all participants, please mute your phone or computer when not speaking, and please do not put your phone on hold as that puts music into the conference line. And for all participants, we ask that you please identify yourself when speaking. We will be reminding people to do that throughout the meeting. And one final housekeeping item, all votes will be roll call votes, and Sarah will call the roll after a motion is made. We'll now move on to item number 2, call to the audience. Please note that members of the public were given opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Were there any comments received, Sarah?
No, not today, Tamara. Thank you.
All right, thank you, Sarah. We will now move on to the next agenda item, which is approval of the consent agenda. Item 3A is on the consent agenda. And as a reminder, please note that board members may request an item be removed from the consent agenda if there is a need for discussion. And board members cannot comment on a consent agenda item without first requesting it be removed for discussion. Do any board members of the COC request discussion on any of these items in the consent agenda?
This is Joan. I just wanted to give an update on legislative stuff, and it can also wait. I wasn't able to give a full comprehensive update to Sarah in advance of the meeting, so I'm happy to talk about it at the end, whatever we have time for.
Perfect. But you don't want to remove it, right?
No, don't want to.
Perfect. So hearing none, do I have a motion to approve the consent items? And if so, please state your name.
It's Eric Cole. I'll move approval.
Thank you. We have a motion from Eric Cole. Do we have a second?
Second, Bruce.
Thank you. And a second from Bruce Liggett. I will now hand it back over to Sarah, who will proceed with a roll call. And please indicate clearly how you choose to motion, stating yay or nay after your name is called.
We will go alphabetical order. Co-chair Ryan Balch.
Yay.
Thank you. Eric Cole.
Yay.
Thank you. Liz DaCosta.
Yay.
Thank you. Marshall Franklin.
Yay.
Thank you. Tad Gary. Samantha Jackson.
Aye.
Thank you. Bruce Liggett.
Yay.
Thank you. Joan Service.
Yay.
Thank you. Charles Sullivan.
Yay.
Thank you. Jackie Taylor.
Yay.
Thank you. And co-chair Tamara Wright.
Yay.
Motion passes. Thank you.
All right, thank you. Coming up next for agenda item number 4, we have the Maricopa Regional Continuum of Care Coordinated Entry Subcommittee revisions to Policy and Procedure Operations Manual to include racial equity language. Wow, that's a sentence. Matthew Kelly, Mercy Care COC Coordinated Entry Subcommittee Co-Chair, will present on the revised Coordinated Entry Policy and Procedure and Operations Manuals for singles and families. And we also want to share that the board is interested in learning more about coordinated entry and what is working and where there might be some opportunities for improvement. and we're interested in planning what that training might look like in the future. So thank you, Matthew. It's off to you.
Great, thank you. So I'm just going to give a quick high-level overview of some of the changes that we made. I think with the policy and procedure, I think it's just the major area that we did update and change to adjust for the racial equity language was really in the guiding principles. The remainder of the document we did review and make some updates and changes. A lot of that was language or clarification or updated to some changes within different, policies that are already in existence. So it wasn't really super significant. There was one other piece within the training realm, making the recommendation that providers do some form of racial equity training. While we don't necessarily know what that looks like right now per se, we did want to include that in the language of the document, just as kind of like a guiding, opportunity for providers to have that there. And that's kind of where the majority of that particular document ends, and what we did there really within the singles and families operations manual, which is really the meat of where we did a lot of the work. And so within those documents, you're going to see that we updated the guiding principles section. Again, there are a number of different edits and adjustments that were made to surrounding racial equity and persons with lived experience. In addition to that, in the oversight section, we did add a statement about including individuals with or persons with lived experience into that oversight process. It was pretty vague in general at this point in time because we don't know exactly what that's going to look like. However, we wanted to include that in the language. In addition to that, we also did some minor changes within the system access section, and I apologize, I didn't write a specific thing, and I think really that was focused on making sure that individuals with different racial ethnic backgrounds have access to the coordinated entry system and making sure that we have access points for that. Prioritization, we also updated that section to acknowledge racial equity within that framework. However, again, I think it's important to recognize that we don't necessarily know what prioritization is going to look like and how that's going to play out for and in that racial equity piece, but we did include that in the operations manual as well. And then the other thing that we did add, and I think it's not so much an addition as it is a clarification. I think one of the major things, and it's without saying it didn't happen, I think it would be an oversight, with regards to the onboarding process. We did add some clarifications on the language surrounding that. It was kind of all throughout the document with regards to what the onboarding process was, the application process, the appeal process, all of those sorts of things. So we went ahead and created an individual section for onboarding and kind of outlined the entire process. So nothing changed necessarily with the onboarding process. It's just that we went ahead and documented that in the operations manuals. Those are really the big pieces that we adjusted. I guess I can kind of open it up to see if there are any questions from the floor.
Thank you, Matthew. Do we have any questions or discussion from board members?
Matthew, hi, this is Jackie. I was just curious to know, are the meetings of the Coordinated Entry Committee public? And is the meeting schedule published?
So because it's not, it doesn't follow traditional open meeting law, it isn't considered public. I will state that as a committee, we've made an effort to make it as available to as many individuals who are interested in attending. We have an invitation that goes out to about 40 different community members who are interested in participating. And what we found is that we aren't necessarily limiting community participation in discussions as long as it doesn't necessarily override the agenda of the meeting itself, if that makes sense. So
yeah,
I think,
sure it does.
Yeah. So that's kind of what we've attempted to do, but because it doesn't necessarily fall under the formal meeting law process at this point in time, we're doing our best to make it as transparent as possible because I think you're kind of getting at, I think it's a process that a lot of people are interested and invested in and making sure that it's working correctly.
Thanks, Matthew. Appreciate it.
Of course.
Matthew, this is Joan Service from the Housing Coalition. Knowing that we have engaged with a consultant to look at, not only our system, our continuum, have they reviewed these changes and provided any feedback?
Yes, so Donald Whitefield was actually a part of the process throughout to give us some feedback on some different things. So we did get their input with regards to that. So yes.
Fantastic.
Hey, Matthew, it's Eric Cole. Thanks for reporting on this. I liked the piece about encouraging different groups to do some form of racial equity training. It strikes me that as groups take that on, it would be a great thing for us to kind of collect who those providers are and what so that we could have almost like a clearinghouse for racial equity providers for the rest of the community. So that might be a MAC staff recommendation, but it might be a way to help everybody meet that goal.
Right, I think so too.
Hi, Matthew, this is Ryan. Thanks for your report. Could you said that one of the things that you focused on was putting into writing the onboarding process.
Yep.
Did that include timeframes for which applications would be reviewed? And if so, can you review that? What is the timeframe?
Sure, I don't unfortunately have a the application to bring up. I can't bring up a document. Unfortunately, I didn't get that permission for today's meeting. I'd have to go back and get you the exact timeframes, but I do believe that we did put some timelines with regards to that. And typically, I think it was about a month was the turnaround time on an application process. But the coordinated entry subcommittee is actually reviewing those applications on a monthly basis. So the leads are reporting out to the subcommittee with regards to what applications are receiving and what the outcome of those applications were.
So decisions are being made on, so basically you're saying decisions are being made monthly on each application?
So the lead agency, as part of the coordinated entry subcommittee, what was done is a tool was created for the evaluation of the access point applications. And that was done by the coordinated entry subcommittee. And then that tool is the guiding point, the guiding document by which the leads actually make the determination. If applications were approved, they're mentioned. If they were declined, they're mentioned. And also the reasoning why they may have been declined is also mentioned as part of the subcommittee. Part of the process that was outlined within the operations manual was actually the appeal process for the provider if they were declined. So they would have an opportunity to appeal that back up to the coordinated entry subcommittee and have it re-reviewed.
Okay, thank you.
Yep.
All right, any other questions or discussion? Okay, do I have a motion to approve the Maricopa Regional COC Coordinated Entry Policies and Procedures and Operations Manuals for Singles and Families? No one wants to make a motion?
I will, so moved.
Oh, thank you, Samantha.
Sorry.
Do I have a second?
A second, this is Charles.
Second, it's Eric.
Oh, we have a second from Charles. And now I'll ask Sarah to proceed with a roll call vote, and please clearly state how you choose to motion and your name when called. Sarah?
Thank you, Tamara. Co-chair Ryan Balch.
Aye.
Eric Cole.
Aye.
Thank you. Liz DaCosta.
Aye.
Marshall Franklin.
Aye.
Tad Gary. Samantha Jackson.
Aye.
Bruce Liggett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
Thank you. The motion passes. Thank you so much.
Okay, the motion passes. We move on to item 5, which is the Arizona Social Determinants of Health program. And Andrew, I'm so sorry if I'm going to mispronounce your last name, Andrew Tarek, Director of Social Determinants of Health with Health Current, will provide a presentation on a partnership between Healthcare Cost Containment System, also known as ACCESS, Arizona's State Medicaid Agency, and 211 Arizona, as they have partnered to develop a statewide closed loop referral system to address the social determinants of health needs in Arizona. Andrew?
Thank you very much. Is everyone, can you see my screen? It's good to go? Okay. So good afternoon, everybody. Thank you for having me. My name is Andrew Tarek, and I'm the Director of Social Determinants of Health for Health Current. And so some of you may have seen versions of this presentation. I'm just going to give a general overview of the closed loop referral system and the project that we're implementing over the next several months. Okay, there we go. It's an overview of what I'm going to discuss. So to start off, as noted, the program partnerships. So this is Health Current has engaged in a partnership with ACCESS and Arizona 211, operated by Crisis Response Network, and we're coming together to initiate this statewide referral system. And the platform that we chose was the NowPal platform. Sorry, I am having trouble with my slides here. Apologize. Let me do this again. There we go. That's better. Okay. We also, as part of this system, we had about over 30 groups meet with us to help us develop the different features for the program. And the program genesis is in the ACCESS Whole Person Care Initiative. So ACCESS has been the primary support of this system. They launched their Whole Person Care Initiative back in November of 2019. And really the focus of that was to bring in those social determinants of health into that healthcare and behavioral healthcare continuum, with a focus on 3 key areas: transitional housing, non-medical transportation, and social isolation. And the social determinants of health shows that if we address these SDOH concerns, we will have better health outcomes, even if that means it's easier for a person to attend an appointment in order to address their healthcare concerns. We are also able to address their whether or not they have transportation to that appointment. We're able to address any other social factors like do they need childcare in order to attend the appointment? Or do they even have a safe place to live in order to attend their healthcare and medical appointments? And so by addressing those social terms of health needs, we can really increase people's ability to engage in their healthcare and live healthier lives. And so the 3 key areas from our purpose is: 1, we want to build that bridge to connect the healthcare providers and the community-based organizations. So in order to address these social terms of health needs of our community, we need to create more accessibility to those services and streamline communications so that a person can get the help when they need, when they need it. Second, with a greater focus on the social determinants of health, we can make it easier for Arizonans to obtain essential social economic services, thus improving their health, well-being, quality of life, making this that whole person care approach. And lastly, this is a data-driven approach. So the system that we're implementing has multiple points of data, including capturing SDOH Z codes, capturing referral data as far as who individuals, where they're being referred to, the amount of distance they have to travel for their referrals, how quickly referrals are being acted upon, and even just seeing referral volume, where are the referrals going. So I'm just going to cover some of the key features of the system. First is building a referral universe. So for this system to really be effective, organizations that already have sort of an existing network of organizations that you're working with. So for example, this group here, and bringing on that full referral network or referral universe of different groups that are working together within onto the system. And by bringing everyone together on the system and creating that network and the closed loop referrals, then everyone who's on that closed loop referral network will be able to see the activity of the members that are accessing those services and see what services they've been accessing and moving across that group, as well as how frequently an organization is being referred to, their response time, the distance, and a lot of other metrics that can really help drive a group or a community to identify where are areas of need, where are areas where we need to bring in more services. And then in addition to that, we'll be connecting to the 211 Health and Human Services Provider Directory, which has over 35,000 services. So not only can referrals be done in that closed loop where you're sending a referral and you're getting that feedback, but it can also be done in a more open referral where you're just letting a person know, here's where you can go to get food or to get assistance with this. In that situation, you wouldn't have the referral feedback, but the person would know where to go to get the help they need. It has a no wrong door approach. So anyone who's using the system can sign a person up. So if your organization is using the platform and a person shows up and they've not been entered into the system before, or if we load a panel of members in there and a person is not part of that panel, but they show up and they're looking for help, you can load them at any point in time. So you do not need to be a specific type of provider in order to load a person into the system and to make a referral. There are screening tools built into the platform. So we have the Prepare screening tool, which is an evidence-based screening tool, as well as several other evidence-based screening tools. In addition, there is the opportunity to create custom tools or modify the tools that are in there to best fit the needs of each organization. We can even build an interface to your health record to capture the screening data in the health record and bring it over onto the referral platform. And the referrals that are generated will be tailored to individual needs, including language needs. So if an individual has a different primary language, we can send all the referral information to them in their preferred language, and the system will output over 100 different languages. And the referrals will also be tailored to the person's physical location, so selecting resources that are closest to them, most convenient to them. And if you have that, once you have that referral network established, you'll be able to see who do we have a closed loop relationship with, who's a preferred provider, and who's just another service provider that provides a service but maybe is not within that network. But I can still make the referrals to them. There are alerts and communication, so a lot of things can be done here, whether that be communicating across the platform as a referral, someone who's making a referral as an organization who's providing the services, as well as alerts to members to ensure that they are showing up for appointments and that they know the different referrals that have been made on their behalf. There are dashboards, analytics, and outcomes. So one of the biggest benefits of using a system that captures all the referral data and SDOH coding is that organizations can aggregate and analyze the data, use it for quality improvement, gap analysis, and business intelligence, all of which will make us more informed. And there's also a raw data package that could be pulled down at any frequency that can then be implemented into whatever business intelligence or analytics platform you're currently using. And lastly, there's a client portal that clients or anybody, even if that wants to download, this is a solution for all Arizonans. So as Access is a key partner, but you do not need to be enrolled in Access to use this system at all. And the client portal is something that members can use to search for services and make self-referrals. And we'll be connecting this client portal to the referral platform so that if a client is making their own referrals and self-referring, you'll be able to see that activity as well as the provider. Just a very quick overview of a couple of use cases. So if you're requesting a service, thinking about who's that network, so building that network of organizations or identifying that network in the system of who you're making your referrals to frequently. Next would be when a client hits the door, they can find their you can find their unique profile or sign them up. So accessing the client quickly on the platform, then use that to screen the person or identify if they've been screened recently, and then make the referrals. And you'll see that screening history and referral history. So if that information was captured at a previous appointment, you might be able to just use that information upon their arrival. Making a referral to the appropriate services. And then lastly, it's getting that referral feedback in those closed loop relationships. And for service providers, They can set up their organization landing page to request specific documents or provide eligibility or capacity information to ensure that members that get referred to them, they are showing up with the appropriate paperwork and they're eligible for services. In addition, there will be a feature on there for community-based organizations to say that they want to pause referrals, maybe because they're at capacity, so that you're not getting referrals for services if you're at capacity. Providers can review that screening referral history before a member even arrives. They can determine the eligibility, send communications to ensure that they're getting that information back when they receive the referral, alerts to ensure the members are showing up, and then providing that referral feedback, closing the loop in those instances. So the program timeline, right now we're still in implementation and planning. We'll be doing some small use cases over the summer to just set up some of the general workflows. And then it'll be available to the community, available to all providers come the fall of 2021. And the next steps, if you're interested, if you have any additional questions, if you go to our Health Current website /SDOH, you can complete an interest form. That'll let us know that you're interested, you want additional follow-up or updates. We will be doing long form demos the first week of May. So by filling out the interest form, that'll get you on the mailing list so we can notify you of those dates and any additional updates on the process as we go. And lastly, there's my contact information as well as our SDOH manager, Clay Cummings. And feel free to email us if you have any questions about it. And I will stop there if anyone has any questions.
Thank you, Andrew. Are there comments or questions, discussion from board members?
This is Bruce. I have a question. Thank you, Andrew, for the presentation. Very informative. Past efforts at No Wrong Door have kind of stumbled into problems with confidentiality, releases of information, HIPAA, all the things that are in place for good reasons that prevent us from sharing. Did you have that experience and how'd you work through it?
Yeah, so we will not be pulling any clinical data from here. So if you're a community-based organization and so you're not a covered entity and you can't see healthcare information and a person shows up, I'm using that no wrong door principle, and you load them into the system, you would only see services related to their community-based movement. You would not see their healthcare information or healthcare services unless you already had that consent relationship with someone who referred that member to you. So it will be set up to ensure that in those no wrong door circumstances, depending on what type of organization, there will be a hierarchy in the system as to what information you can see, so that we are not having the issue of displaying healthcare data to non-covered entities.
And if I may, we used to in the past have the concept of a primary or lead case manager. Is that applicable here, or in effect now is the system the lead case manager?
Well, I think that there will still probably be case managers, and the system does have the ability to, for individual client profiles, to identify resources like who their primary provider is. But I think it really has the flexibility to be used how you want. So if you're wanting to identify that within the system, you can. And if it's not part of your workflow, then you don't. It's not a requirement.
Thank you.
Well, thanks, Andrew. This is Jackie. So this may be a crazy question, but a lot of times to access services, the client needs to have certain documents. We call it document ready. Mm-hmm. Are there any resources or points in the system that help the client become document ready for certain services?
So we've a couple of things that can be done. Ideally, meeting with the person and helping them load those documents so they can be loaded onto the system and then sent as part of the referral. So if you're referring them to an entity, you can send that over so that when the person shows up, they would open that and the documents are sitting there ready to go. So you're not putting the onus on the person to make sure that they're remembering to bring them for the appointment. So that's one way of doing this. And another thing that we are working on, and this is more kind of in this conceptual phase where there's no sort of implementation of this yet, but we're looking at the idea of if there was a digital wallet, and then, so the member could have more control over that in terms of, because right now in the example I gave, you'd still need to go to the provider to access the documents. And we're looking at, is there a possibility at some point to have a digital wallet where the member can have their documents as well? So that would be like down the road.
I think that's fantastic. So somewhat of a repository to hold those documents is a great idea. Thank you.
Andrew, do you think you could talk a little bit about, or maybe this is more of a Ty question, I saw Ty was on here, but about how this would either layer on top of or help supplement our coordinated entry system and for homelessness?
Yeah, actually, I would defer that to Ty. I think he would probably be able to speak better to that than I would. I know we discussed this at a high level, but I don't want to put you on the spot, Ty, if you're there.
Hi, everybody. Madam Chair. Name is Ty Rosensteel. I work at Crisis Response Network. And to field your question about how this type of system will interface with coordinated entry, the way that I think about this is that this is around providing coordinated care for people that are in the medical system to get access to social services. So as it would exist right now, we have our medical providers doing either direct referrals to coordinated entry and working with coordinated entry, which is great, or they're trying to work directly with individual service providers to initiate care for their patients on, sort of like a side door approach. This type of system would interface with and really need to ensure proper coordination with all of the different sectors of care, not just homelessness, but also food security or income security. So the way that I personally think about it is that, if a hospital or a medical provider is signing up for this system, the first resource that's going to come up if a person is looking for housing resources are the coordinated entry sites. So it'll be a more appropriate funneling of individuals from the medical system to our coordinated entry system rather than utilizing side doors that may exist. Does that make sense? And Andrew, is there anything you'd change or add?
That makes total sense to me. Thank you, Ty.
Thank you. Any other questions or comments from the board? All right, thank you so much, Andrew. We'll go ahead and move on to the next agenda item. Item number 6, which is the 2021 HUD COC NOFA scorecard. We have Julie Montoya, Human Services Planner at MAG, who will present on planning for the 2021 HUD COC NOFA scorecard and highlight the changes being recommended. Julie?
Thank you so much. I'm going to share my screen if you all want to follow along. Or the scorecard is also on the MAG COC board webpage under materials, if you prefer to pull that up instead. So if you can give me 1 second to share my screen. Okay, are you all seeing my screen okay?
Yes.
Yes.
Although it's a little, if you can zoom a little bit, it's a little,
okay.
with my computer, it's a little small.
That better? Okay. All right, perfect. So thank you, Madam Chair. So at the March board meeting, it was requested that an ad hoc work group be formed to review the COC scorecard to be used in the 2021 COC NOFA competition. The group consisted of board, data subcommittee, coordinated entry, and ESG chairs, and a representative from the racial equity work group. The proposed recommendations have gone through the data subcommittee and the COC committee, and they both made a recommendation for approval. So I'll just go right into the recommendations. So starting here with 6A, participation in coordinated entry. At least 95% of persons enrolled were referred through the family and or CWO's coordinated entry system. So here, basically scale of points and percentages were reduced. In the previous year's scorecard, It was worth 8 points total, and the 95% benchmark was right in the middle of the pack here. Now, the total points you can receive is 6. If you meet the 95% benchmark, the project can receive full points. This change is being proposed due to the board's priority to evaluate the coordinated entry system this year. And during discussions, there was some concern that there may not be equal access to coordinated entry based on location. So if you're located in the East or West Valley, there were concerns that it's not as easy to access coordinated entry as it would be if you were located in Central Phoenix. So this group wanted to scale down the scoring this year to give a chance to assess the coordinated entry system. And then this metric would be up for review again in the fall for next year's competition. Moving on, number 7, COC engagement and participation. Looking right here, 2 points for participation in the 2020 unsheltered pit count. So this year, the COC received a waiver for the 2021 pit count. So the recommendation is to give the default points to all projects and keep it on the scorecard moving forward. So we didn't want to, the recommendation was not to remove it. And then you won't see this here on the scorecard, but there was a question in previous scorecards around cost effectiveness. And in years past, this has compared projects against other projects by looking at the investment per person who exited to permanent housing. So there have been questions about this particular metric in the past for cost effectiveness. And the recommendation was to remove this metric and look at a new way to measure this for next year. Nationally, HUD has not provided a great way to measure this, and other COCs have taken this off their scorecards as well. And so, you know, like I said, the plan is to review it again next year to see if we can find a better way to measure cost effectiveness. And then the last revision was here, number 11, racial equity. The work group added 2 questions. One was for addressing racial equity in the organizational system, and the second one addressing racial equity in project services. So these would be narrative responses worth 2 points. The goal will be to continue to add to the scorecard every year in this area. And this work group recommends that the racial equity work group work on creating specific standards that would be on the scorecard next year, and then eventually get to the point where we're looking at specific data metrics for scoring purposes. So I don't know if there's any questions or comments, but that concludes my presentation on the recommended scorecard revisions.
Thank you, Julie. Are there any questions or discussion from board members?
Tamara, it's Marshall.
Hi, Marshall.
Hi. So just a quick question. One, it was hard for me to see it, so I'm sure it's my screen, but it's really hard to see it. But did we, and I could have missed it, did this come out ahead of time? Ahead of our...
The scorecard was posted on the MAG webpage.
Okay. But did it come out with our council packet? And I'm just asking, I apologize, hold on just a minute. Just so I'll go take a look at it. So, okay, so it's on the website.
Yes, with the materials.
Okay. Thank you.
Yes.
Okay, are there any other questions?
It's from the Housing Coalition. So I'm pleased to see I think in the last go round, and this is, I think, in a pre-COVID world, we really struggled with the appropriate balance on points for racial equity. Curious if our consultants kind of blessed this to say, yeah, this is an appropriate response, or do we need to be more aggressive, or how? I just obviously want to make sure we're as competitive as possible.
Yeah, great question. Yes, we did run this by our consultants, and they were, very pleased with having this addition to the scorecard as well. They did, recommend, according to what the board feels is, if we need more points on there, we could definitely add more points. I think our thought initially was that we just wanted to get it on the scorecard, and it's something that the board has been prioritizing the last couple of years. So, that would be up to the board to decide if they feel like there should be more points included on here.
And to back that up, I was part of that committee also, and we also wanted to give providers time to start implementing some of their own racial equity frameworks into their agency and into their work. And so this is sort of a jumping off point that this is coming, and then the next scorecard could have some more tangible and much more, much higher point threshold for the racial equity questions. But we wanted to give people an opportunity to start working on it and see that it is coming and it's going to be part of the scorecard.
This is Jackie. Having been on the review of this the year before, I just commend the ad hoc group on the thoughtfulness of the changes. Really good work.
Also, Joan, this is one of those items. There was one other one, having had the opportunity to participate this year, that the change is being made so late that everybody's being judged on criteria they didn't know was coming. So again, like Tamara said, it's a nod to the fact that this is coming. And then people will have a full year to respond next year. And they talked about being more specific before next year, so that people would know what exactly they're being rated on. So these are pretty broad, but that would be the reason.
Awesome. Thank you for that.
And one other thing I'd like to add is, the work group, we did discuss about making sure moving forward that we're providing an opportunity to review these well in advance. And obviously with the COVID year, everything kind of pushed everything back. But really looking at reviewing the scorecard every year, maybe in the fall, right after the NOFA competition occurs. So we really have time to address any possible changes, and the providers also have an opportunity to address that as well.
Any other comments from the board?
I'm just curious, before this came to the board, was there an opportunity to run it past the committee as well?
Yes, it did get pushed through the data subcommittee as well as the COC committee, and they both did approve a recommendation to move forward.
Awesome. Thanks, Julie.
Any other questions, or people kind of still reviewing? Okay, do we have a motion to approve this scorecard?
This is Joan. I'll make that motion.
Thank you, Joan. We have a motion from Joan Service, Arizona Housing Coalition. Do we have a second?
This is Jackie. I'll second.
Thank you. And we have a second from Jackie Taylor from Save the Family. I will now ask Sarah to proceed with a roll call, and please indicate clearly how you choose to motion after your name is called.
Thank you, Tamara. Co-chair Ryan Balch.
Yay.
Eric Cole. Eric Cole, are you on mute? I can't hear you, but your mouth said aye. Okay. Liz DaCosta.
Aye.
Marshall Franklin.
Aye.
Tad Gary. Samantha Jackson.
Aye.
Bruce Liggett.
Aye.
Joan Service. Joan Service, we can't hear you.
Oh, sorry. I.
No worries. Charles Sullivan.
Aye.
Jackie Taylor.
Aye.
And co-chair Tamara Wright.
Aye.
Motion passes.
All right, great. Thank you so much, Sarah. We'll now move on to item 7, which is the Regional Homelessness Strategies Update. We have Meadow Robinson, Directing Attorney with the National Consultant Homebase, will provide an update on the proposed regional homeless strategies and draft tactics that are being developed as part of the portfolio that will be offered up for action in May. Meadow?
Yeah, thanks so much. Another very long sentence for you. Sorry about that, Tamara. Not making it easy for you today. Hi, everybody. My name is Meta Robinson. Probably you've heard from myself or perhaps some of my colleagues from home base. Basically, our team has been working with Meg and local partners to take all of the really robust stakeholder feedback that's been developed over months long, different processes, and gather it up, aggregate it, and really package it into what's become the strategies portfolio. So I'm going to give you a little bit of an update today on where things are at. We're going to do a little bit of a dive into some of the tactics development that's been happening. And so we're going to give you kind of a preview today. That's really what the update is meant to be, is for you to see some of the granular how thinking that's going on to drive these strategies home. Next slide. Thank you. So as mentioned, there's been months-long effort to really get robust stakeholder feedback through a variety of methodologies, surveys, one-on-one key stakeholder interviews, focus groups, larger strategy sessions with important stakeholders who really have knowledge and expertise in their relative spaces. And so what that all culminated in was basically 40 strategies, which then have been narrowed down, and it's really these 14 priority strategies that are making up the homelessness portfolio report. And some of what we're going to be thinking more specifically about implementation of. So those 14 priority strategies are nested into the 5 categories that you see there: prevention, diversion, housing, coordination, services, and temporary housing solutions. Next slide, please. This slide just gives you kind of a quick snapshot of each of the 14 strategies and where they live within those 5 categories. So you may have seen this slide before. Just helps folks know that as we're digging into some of the specific pieces of the strategies that we will today, we're going to focus in on 3. Know that we're undergoing the same process of developing tactics for each of these 14 strategies, really with the idea that we want to have some actionable next steps tactics so that we can kind of hand those off to the folks who will be really focused in on the implementation of this work so they can kind of hit the ground running. Next slide, please. So what we've been doing to develop these tactics is, like I mentioned, the 14 strategies have been identified. Those have been the ones that the region, stakeholders across the region have sort of said, these are the ones that we want to drive on first. There'll be some sequencing within those 14 strategies. They all won't move forward at the same time. There's lots of crossover and coordination that needs to happen within each of those strategies. And so in thinking what implementation looks like, a lot of what we have been doing is really trying to dig down and pull apart each of the individual strategies into the how. And so what we've been doing, we've been utilizing a stakeholder input process, and we're doing weekly sessions where a bundle of the strategies are brought forward to that group. Each group is made up each week of various folks with relevant expertise. Sometimes the group looks the same week over week. Sometimes it looks a little bit different. A lot of you, I think, on this call, I'm seeing some familiar faces and names. So I appreciate the effort and energy that you've taken to attend those weekly stakeholder input sessions. All of that good work is what's developing this how. And so there's the 5 categories. We've done 3 sessions so far, 3 of the weekly sessions. So we have 2 left to go. And we're going to give you a little bit of a preview today of some of those tactics that have been developed, really just to kind of give you a sense of where things are at and how the implementation, how we're sort of pivoting from the strategy prioritization and identification to this implementation moment. Next slide, please. So we'll dig in on 3 of the strategies today. We're going to dig in on strengthening the regional shelter system, expanding and coordinating landlord engagement, and then expanding and coordinating the flexible housing fund. So those are 3 of the 14. And we'll give you just kind of a little sampling of some of the implementation nuggets that are coming up, some of these tactical bits of the hows. So next slide, please. Starting off with strengthening the regional shelter system. Folks really want to make sure that this is a data-informed approach to developing what this strengthening and enhancement of the regional shelter system looks like. So specifically, folks have called out here, leveraging data to identify goals for increasing shelter capacity, specifically with reference to geographic location and subpopulation needs. So making sure that we have sort of that data-informed approach before we're making any decisions around developing or enhancing the shelter system. Specifically, just a finer point on it here is looking at disaggregated data to understand inequities kind of across the region within the current shelter system. Another one of the tactics, and you'll see this come up a lot, is just coordination across jurisdictions. And this one specifically calls out coordination with respect to funding and resources or site locating, and really making sure that there's regional goals established that are informing some of that coordination across the funding and resources piece. Another one here speaks to developing or including a network of small capacity shelters. So we often think of kind of large congregate traditional style shelters. Folks are in developing this strategy or wanting to think about different models and how those can potentially better integrate into the community, and really thinking about a population specific focus, meeting the needs of those that are currently unmet. Next slide, please. Another tactic that came up in the thinking of how do we strengthen the regional shelter system is, a part of how we do that is increasing the flow from emergency shelter to permanent housing solutions. And so folks really wanted to make sure there was a focus on increasing that flow, which makes a lot of sense. A couple finer points on this are looking specifically at any policies that slow the transition from shelter to permanent housing and digging in on those and figuring out how we can alleviate through a policy approach any of that slowing. And then this bullet here calls out allowing for longer term stays in some shelters. This one might seem a little counterintuitive, but the idea here is that some of the shelters currently in the region have a very a short-term stay policy. And so what's happening is that sometimes people are timing out of the shelters. They don't have the ability to stay long enough to get stable and housing focused and line up housing for their exit. And so what's happening is kind of a bouncing between shelters because there's this timing out that's happening, as opposed to an ability to stay for a longer period of time, really get that housing focused piece locked in, and then flowing through shelter into permanent housing as opposed to kind of bouncing between the shelters. So that's what that one is about there. Another piece here to enhancing the system really has to do with the services side of things and the behavioral health service provision specifically, and the marrying of housing focus and behavioral health services together. So a couple of things just to call out here is really thinking critically about how to deepen access to behavioral health resources, and partner really across the region to deepen that access in a way that allows folks to tap into models like trauma-informed care, strength-based approaches, and things that we know work well to serve this community of people. The other thing that folks called out was just making sure that shelter guests in particular are getting access to these behavioral health services as soon as possible. Sometimes, depending on the community, shelter and behavioral health, folks staying in shelter can have sort of varied access to behavioral health services. Sometimes that's more a part of once they get into housing, it's a little easier to marry with the housing provision there, but really thinking about keying in on that delivery with shelter stairs. Next slide, please. I think this is the last slide for the regional shelter system piece. So thinking about the staff turnover component, really strengthening the regional shelter system. Part of that has to do with making sure that frontline staff are well supported, that organizations are, able to deliver the kind of quality of services that they want to deliver to their clients. A lot of that has to do with what does staffing look like? Are people overburdened? Do they have the adequate trauma-informed training to be delivering those types of services? Just some deeper thinking around staffing in general, but also thinking about that high staff turnover rate. Not uncommon in this region, not uncommon in this work, high burnout, it's a lot. And folks are often kind of jumping from provider to provider. And so thinking too just about if people do leave, why are they leaving, and how can we build up the capacity internally to keep staff where they're at and keep them happy. Another piece of the regional shelter enhancement, strengthening that system, was folks mentioned the tactic of creating interdepartmental teams across city services. So kind of mini teams within city entities that would have staffing from human services, police, fire, library, et cetera, to really come together and do some information sharing between each other and thinking critically about service delivery in a more holistic and multi-dimensional approach. Some more regional coordination here that's called out, and then thinking specifically about the public education campaign around this work was something that came up a lot in the strategy sessions. Folks want to make sure that there is an intentional effort about this education that goes for both sort of local citizens and for policymakers, really knowing that that's some of what's going to catalyze actual change and create momentum in strengthening shelter systems. Next slide, please. So moving on through our strategies here, this one's about coordinating and expanding landlord engagement. So another solid bunch of tactics to create that jumping off point. Identifying funds is obviously a big piece of this part. How do we utilize both what we have in-house and think about the COVID-19 funds and any other local partnerships that can sort of expand the available resources to make a better and more fulsome landlord incentive program, and one specifically that includes risk mitigation. Another tactic here is creating a centralized protocol. So this would be for outreach, messaging. It would really be centralizing kind of the whole landlord engagement system so that programs aren't competing for the same landlords, so that landlords aren't getting different information from different programs, sort of just streamlining and centralizing what that program looks like so that kind of everyone's on the same page and there isn't so much competition for landlord resources, so to speak. One of the strategies, one of the tactics to support the strategy that was called out was introducing concepts or enhancing whoever might be doing master leasing. So one of the ideas here was coordinate with landlords and, essentially utilize the opportunity of larger homes, which would be leased by provider agencies, to do things like home sharing. So instead of sort of a 2-bedroom house, which might be the appropriate fit for a smaller family, thinking about how to capitalize on some of the larger homes that are available in the region and think a little bit more creatively about how you could put kind of create a shared housing arrangement in those homes. Next slide, please. This one here is a lot about outreach to landlords and specifically thinking creatively about how that's done, targeting landlord groups, targeting certain gatherings of landlords that might occur to develop partnerships and really, again, utilize these as an opportunity for an educational campaign, hosting some regional landlord fairs, and really thinking critically about what are the existing local programs that are in place, doing good work with great relationships, and how do we scale those existing programs? No need to, create anew what is already working well. So really thinking critically about that. Another piece that came up was just who can be the champions of this landlord engagement, both I think from a political perspective, elected officials, and even just within the provider community. the more that the word is getting out, the more landlords are going to sort of bubble to the surface. Folks might not have a good sense of what it means to be a landlord working within these programs, and there might be certain stigmas that could easily be met with some great educational materials and kind of a consistent messaging landlord campaign that we talked about in the previous slide. The last one here, I think it's important, and I mentioned it a little bit at the outset of the slides, making sure that landlord engagement is coordinated with prevention and diversion strategies, which are a part of the 14 strategies, and also with the housing flex pool, which is the strategy we'll talk about next. Because the landlord engagement here is, it will be a part of, it's a standalone strategy, but it also is a big part of the prevention and diversion efforts. And the Housing Flex Fund will often be in communities where you get some of the incentive monies to incentivize landlord engagement. So just making sure not to miss opportunities where there's coordination that can happen between those strategies. Next slide, please. Last strategy we're going to give you a little glimpse into is the Flexible Housing Fund. So there were quite a few local success models that people wanted to make sure were on folks' radar. That included the ones you see on the screen, the Arizona State Wildlife Utility Assistance Fund and the Howard Epstein Housing Fund. So again, not creating things brand new if they don't need to be, figuring out how to scale what's working well. Again, some coordination bits here to develop seed funding. And this specifically calls out multi-sector partnerships, such as managed care organizations and philanthropic partners, of course. Data collection is a big piece of this so that there's a sustained way to basically make the business case for a flexible housing fund. How can we continue to get partners to be a part of the funding effort? What's the kind of information that's going to be interesting to them to show impact, basically? So making sure that data collection and outcomes and measurement is a part of the thinking from the get-go to sustain that ongoing support. And then really important here, ensuring that community partners and people with lived expertise of homelessness are a part of this program design, including and really capturing the voice of folks with lived expertise in all of the implementation work moving forward, and strategy development across the board is actually its own standalone strategy as well in the 14. So just wanted to make sure that folks knew that, but that's an important part also of each of these strategies, really. Next slide, please. Last one on the Flexible Housing Fund, similar to the landlord engagement strategy, developing program protocols that are streamlined, consistent across the region, and advance racial equity. For this one, we really want to focus on filling the gaps where other resources are not meeting the need. So first, getting kind of a sense of if there are flexible funds that are available in the region, what kind of eligible activities or what kind of eligibility criteria do those have? If they don't, for instance, cover move-in assistance or furnishing a new apartment, perhaps that's what this flexible housing fund should include. So being really concerted about sort of inventorying what's currently out there and what can be purchased or used with any current flexible funds, and making sure that this does something different and fills a need. And then last one here is just coordinating the development of any kind of a flex pool initiative with other priority strategies. We talked a little bit about landlord engagement already in the prevention and diversion piece, but making sure that this is a standalone strategy, but it's also a piece that props up some of the other strategy development. So making sure to check in as those other strategies are developing and utilizing any lessons learned to inform the program development on the Flexible Housing Fund side of things. I think that's the last slide. We'll go to the next one just to be sure. So that's just kind of a little bit of a snapshot of some of the granular thinking that's happening. We're making this pivot toward implementation from aggregating all of the good strategy work and from writing the report. And so the report will be ready for review soon. And as it's just being polished up, we're already having a mind to what's next. How do we create, actionable steps that folks can really hit the ground running with, and starting to think about identifying some of those really important partners and leads on that implementation work. If you have any questions, our email is there. That reaches our whole team. Really grateful to each of you, and especially for so many of you who've been on those Wednesday strategy sessions. Lots of good things are happening there, and we're super grateful to you all. So that's it for me. Thanks so much.
Thank you so much, Meadow. And thanks for your comment at the end, because that was going to be my very first question. Was I think that we've had some of this TA before, going through coordinated entry, going through this, that, and everything else. And I think where we keep dropping the ball is operationalizing what the TA has provided. And so I'm really glad that the report's going to have some milestones, maybe some, what am I trying to say here? Like a goal date to have things done, and as well as the leads, so we know who's responsible and what we're supposed to be doing. Because I think that that's been where we've been caught up in the past, but not getting things done.
Yep, and you're not alone. I mean, it's hard to write a report, and it takes a lot of energy and getting all this information and data from folks. And then, sometimes people have sort of lost their steam once all of that's done. But the wonderful thing about this community is there really is this incredible sustained energy. People are really hungry for the how do we do it, and like give me the next steps. We're kind of out of this like bigger thinking. We've done all the big thinking. Now let's dive in. So I am feeling very confident that you all will continue charging forward, and we'll be here to help for some of that implementation planning.
Awesome. Thank you so much. Are there any other any comments or discussion from board members?
Hey, it's Eric. I would just like to throw in my appreciation and thanks. I've gotten to be a part of the Wednesday meetings, and it's been really, really illuminating, especially bringing in folks from the different sectors and the different disciplines. So I'm appreciative. I hesitate to talk about that I've been a part of it, because I think you board members might ask me questions, but I'm happy to try to answer them as well. Although the experts are clearly the folks that have been running the process.
Thanks for saying so, Eric. Yeah, it's been great. So many diverse voices and just different levels of expertise. I think that's what's amazing. You never know. You don't know what you don't know, and you get a lot of good minds in the room together, and people jump off from what they hear from each other. And sometimes it's just breaking open those little opportunities that you're like, aha, that is something that really feels actionable and relevant to this specific community. That's right. I think what we're really getting at.
Right. Yeah. Folks have been very honest and open, which has been great. All joking aside, seriously, if any board members do have questions or want, feedback through my perspective on it, I'm happy to talk to you about it.
Thanks, Eric. Any other comments or questions from other board members? Okay, well, thank you, Meadow. That was awesome. So nice to see the strategy going forward. All right, we'll move on to item 8, which is funding for housing and homelessness initiatives. So MAG staff Sapna Gupta and policy planner with MAG, as well as Joanna Carr, policy and research director from Arizona Housing Coalition, will offer a joint presentation on this item. Thank you.
Thank you, Madam Co-Chair and members of the Board of Directors, for the opportunity to present the findings from this study. The survey and analysis was developed with Sarah Murley from Applied Economics, and we are very grateful for the assistance and feedback from our counterparts in the cities, towns, and the counties in the course of this work, including some of whom are members of the Continuum Care Board. The goal of the study is to give us an understanding of the regional investment as a foundation and context for additional ones, such as the ones that Meadow discussed and presented to you. We need to know how much we're spending now as context for how much we will need to spend to implement future strategies. This will help us take action and allows the region to develop a common understanding of how funds are being spent and what expenditures are being incurred for which types of programs. This study helps us get there. The study focuses on expenditures administered by MAG member agencies, which includes a region that is larger than the Maricopa regional continuum of care. And we understand that there are a multitude of nonprofits and service providers that provide critical and important services. And also the philanthropic sector provides a tremendous amount of support. However, for this study, we focused on expenditures by the cities and towns and the counties. Next slide, please. The survey results reflect responses by 17 municipalities so far and Maricopa and Pinal counties, representing about 95% of the region's population. They do not include MCSO, Maricopa County Sheriff's Office, and criminal justice expenditures. The numbers here are for fiscal year ending June 30th, 2020, and include the usage of COVID relief funds to respond to the pandemic emergency. I'll be talking first about municipal expenditures on housing programs for persons and households who are experiencing homelessness. I will show totals for services for persons experiencing homelessness, followed by a slide on expenditures for services to low-income persons and households. And then we will look at the total expenditures across the region. Next slide, please. Now, this slide shows how the almost 50 million in expenditures are apportioned among the different housing programs, including shelter. As you can see, the largest proportion went toward the hotel motel category. And just wanted to let you know that we're confirming if one of the categories and one of the expenditures in that category of 15 million is actually for the fiscal year ending June 30th, 2020, rather than the following year. Now, if that ends up being the case, the largest category would be emergency shelter iHelp. As it is currently, the emergency shelter, temporary and bridge housing, and the hotel motel category total about 29.7 million. Next slide, please. This 6.8 million total is for services to persons experiencing homelessness. While the chart on the slide is the same size as the prior one, as you can see, the scale is different and very different from the prior slide as well as the next slide. So in total, you have 6.8 million. As you will see, that percentage is one of the lower percentages for when we look at expenditures to address homelessness as a region as a whole. We'll see that later in the slide. Next slide, please. Now, this 69.3 million total includes categories that encompass services to persons experiencing homelessness and other low-income persons and households, and includes homelessness prevention, which was bolstered last year by pandemic relief funding, as we all know. It's a large number, though. Next slide, please. This slide summarizes the study results so far. As you can see, by far, the two largest categories are housing programs, including emergency shelter and temporary housing, at 40%. That's the almost $50 million that I showed in that prior slide. And then services to low-income persons and households to prevent homelessness. The services that are targeted to persons experiencing homelessness out of this total is about 5%. And that figure was the earlier figure of 6.8 million that I had discussed. Next slide, please. In conclusion, the expenditure study is a baseline needed effort in order to plan the next steps in addressing homelessness on a regional basis. Information on the expenditures hasn't been mapped out this way before, and this is the first step in developing a regional understanding of where and how funds are being spent. Now, Joanna's presentation following mine will show how the region, and actually the entire state, can track how and where COVID relief funds for housing and homelessness are allocated. Now, this will help us develop a regional understanding of funding the strategies combined with this expenditure study, which we hope to complete very shortly. Now, as we're talking about the strategies, the portfolio that Meadow discussed will be proposed next month. And Madam Co-Chairs and members of the Board of Directors, this concludes my presentation. Joanna, the floor is yours.
Thank you, Sapna. Hi, everybody. Yes, as Sapna mentioned, the purpose of my part of the presentation today is to provide an overview of what funding is available under the American Rescue Plan Act and other federal stimulus funds, along with some information on what eligible activities are. I will be focusing my attention mainly on opportunities under the American Rescue Plan Act. However, I do also want to give a very brief introduction of our federal stimulus fund tracker for housing and homelessness, which provides information on all known stimulus funds for that purpose. Through this tracker, we've tracked stimulus funds for housing efforts statewide that were broadly allocated under 3 bills. The CARES Act introduced in March of last year, the US Treasury Emergency Rental Assistance Program introduced back in December, and then the American Rescue Plan Act, which was signed into law on March 11th of this year. We've tracked an estimated total figure of 543.5 million allocations that are available for housing and homelessness related efforts within Maricopa County, either to local municipalities or local nonprofit agencies. That amount is not complete. It doesn't include the emergency voucher program under the American Rescue Plan Act, and we're waiting for information on those allocations to come in. Next slide, please. So the tracker can be viewed on our website, and the link is available here on the slides. You'd have to scroll down on the webpage to find the link to the tracker. Listed on the slides here is a list of information that can be viewed in our tracker using the various tabs. And please note that we have included a separate tab at the end of the document specifically for Maricopa County, so that's where I would direct attention to. You might also find the information tab useful too for information on each particular fund and their allocated purpose. So the intended purpose of the tracker is a universal resource available to any entity or individual who's interested in how stimulus money is being spent or can be spent. Next slide, please. So to just give an overview of the American Rescue Plan Act, Arizona should be receiving a total of $602 million in American Rescue Plan Act dollars, and that's specifically just for housing and homelessness related effort. And there are a number of allocation categories, most of which are going to the state, either DES or the Department of Housing. The 2 funds under the American Rescue Plan Act that will be allocated or have started to be allocated to local jurisdictions and the PHAs are the Homeless Assistance and Support Services Fund, also known as HASSP or ARP Home, and then the Emergency Housing Choice Voucher Program that will be going to the housing authorities directly, and that's the information that we're waiting for. Next slide, please. So the HASSP funds have been allocated now using the home formula, and receiving jurisdictions within Maricopa County, the county itself, the city of Phoenix, and the city of Mesa. And we've tracked a total of 43 million under this fund to those specific jurisdictions. Jurisdictions have until September of 2025 to spend down on these funds. And then the Housing Choice Voucher Program will be allocated, as I mentioned, to the housing authorities, and we're waiting that update on which authorities and the dollar amounts, and that will be added to the fund tracker when we have that information. The vouchers have a time limit of 5 years. Next slide, please. So I want to provide a quick overview of eligible spending activity under the HASSP. These funds can be used broadly for tenant-based rental assistance, the development of affordable housing, support services, and the acquisition and development of non-congregate shelter, which can also later be converted into permanent housing solutions. And there are a couple of documents in the meeting packet that have been posted on the website that give more detail on the allowable spending. One comes from CSH and the other one from the National Low Income Housing Coalition. So that may be a useful resource for you. Next slide, please. And then I just wanted to, I guess, wrap up this part of the presentation by focusing on how the funds might be spent and what opportunity we have here. What we really have in front of us with these funds is the opportunity to bring more units online. We know that we can't end homelessness until we have more units or enough units of accessible and affordable housing. We also know that existing vouchers are underutilized and there's an increasing need for landlord incentive programs. So it was great to hear that being mentioned in the last presentation. There's also the opportunity to braid other stimulus funding to create incentive programs that help to leverage voucher use. And then communication and partnership with the housing authorities is critical as the housing choice vouchers come in. And additionally, there is appetite to leverage unused buildings for affordable housing, including hotels for non-congregate shelter and permanent housing. This is a model that HUD has released some guidance on and it would allow for efficient conversion that's cost effective. National examples we know have shown the use of hotels for safe non-congregate shelter that can be converted easily into a permanent home. And since the HASSP allows for support services, there's the opportunity to braid capital for acquisition and development with support services to promote housing stability. And finally, it's important to mention the opportunity to leverage any unspent CARES Act dollars for these efforts, and a strategic approach that leverages funding opportunity to meet the demand would really create the most effective strategy to bring more units of housing online. And this is where I guess we have the time crunch. CARES Act dollars that are unspent have a shorter time limit. For example, the ESG CARES funds must be expended by March of next year. And all deadlines can be viewed in our tracker. We have listed all of those so that folks can really get an understanding of when funds need to be spent. So that concludes my part of the presentation. I thank you for your time and invitation to have me present.
Thank you so much, Joanna and Sapna. Are there any comments or questions from the board? This is really great information.
Madam Chair, I have a question if I can. It's Samantha.
Yes, please.
Oh, thank you. Joanna, on the you mentioned like the acquisition of you know, kind of braiding that capital, you know, that sort of area there. Do you guys know of anybody that is currently working in that area right now in terms of building new or even doing adaptive reuse in that area?
I know of a couple of communities that are exploring it currently. Flagstaff, for example, are exploring the acquisition of a hotel for non-congregate shelter, and I believe then to move into permanent housing. And they are using CSH. I don't know if they are using CSH sort of by contract for technical assistance, but I know there has been a connection there. And CSH have provided some guidance on how this model can be utilized. And I believe there's talk of Tempe too, but I don't know enough details in terms of hotel acquisition. I've heard that they are exploring that model. Otherwise, there's a lot of national examples that I can perhaps provide the details of. If you want to shoot me an email, I'd be happy to provide some resources and examples of communities that are using this.
This is Joan. be remiss if I didn't say excellent job, Joanna, but I'm a little biased in that. So excellent job. But I think Cass is also their Bridge Hotel. I think they're looking to see if they can acquire that. Again, I apologize. I don't know all the details on that. And I know, when we've lifted this up as a best practice or an innovation that, not only local communities, but our state can really adopt, we've pointed to, I think, Cass, to Flagstaff, and I think even Tucson is doing similar things. So again, we're really seeing that, as to Joanna's point, it's not just a national thing, but we're doing it here locally as well.
I have a question. I just wonder how much I know you said Tempe and Flagstaff are working on this, but how much are our municipalities in Maricopa County aware of what they can do with these funds? And I'm thinking, I know Tempe's doing it and they have a local housing strategy, and Phoenix has a local housing strategy as well. And so I'm wondering how they're going to utilize this to help further implement that local housing strategy.
Well, we have actually developed an advocacy letter for local municipalities statewide, including Maricopa County, targeting those that are receiving specifically HASSP funds. And that's going to be going out this week to really communicate these opportunities as a recommendation. So I don't know exactly the answer as to who is adopting, but we are going to be advocating for them to consider the use of these funds for these purposes.
Okay, great. Thank you. Did anybody else have any questions, feedback?
Madam Chair, it's Eric. I do have a couple of questions and a comment. Sapna knows I watched one of the presentations earlier to the regional council, I think, or the executive committee for MAG. And I'm curious, well, first of all, this work both of these are just phenomenal. It's such, I know having tried to do it in other places, it's not necessarily easy either. It's, so thank you both. It's really, really, really helpful. Sapna, do you have a sense of when, I mean, these things are never done, I know, but do you have a sense of when you'll have this in, kind of that right spot for sharing, or are you already there? I mean, in terms of, comfort level with kind of getting this back out to the municipalities.
Madam Co-Chair and members of the board, thank you for the question. We're very close. So in terms of the percentage of population that we cover, we have responses from cities, towns that cover about 95%, and we're expecting a couple more responses this week. So we're very, very close. As you mentioned, it's an iterative process. What's really good is that we'll have a good idea of the expenditures from the cities for the fiscal year ending 2020. And now that we have gone through this process, it'll be a lot easier to update it for 2021. But we're really very close. Some of the cities and towns that have not responded are in population smaller size, so they may not have the same capacity, for example, having a human services director and human services staff to look at that. But we actually hope to finish it between the next couple of weeks to at least confirm that there were no expenditures on their end. And I think that might be what's perhaps keeping some of the municipalities from responding, is that they want to make sure they're captured. And your question brought up another point, is that in the survey that we sent out, we did provide room for the jurisdictions to respond if they're providing in-kind services. And so we did measure that. It's not in these slides. The key is to make sure that as we list those, that we're able to not necessarily compare them, but make a note that these in-kind services are being provided.
That's great. Thank you. I found the conversation between the mayors about who had responded and who hadn't to be kind of funny, and how they would respond to work to remind folks. So my other, I guess this is a comment, but I noted and have noted in a couple of those conversations with the municipalities that, they are pushing, as they are very want to do, pushing towards the question around, the necessary funding to enact not only our strategies, but I think they're looking for, for kind of housing and related homelessness solutions in their communities. So I know, I guess I'm just telling the board, if you haven't, looked at some of those meetings, there was a pretty pointed, but I think appropriate conversation about, where additional funding could come from for the system overall. And then, the touchy part about how do you figure out what percentage and where those dollars might go, towards some of these strategies. So I think we have helped spur a really important conversation that probably also has created a bunch of questions in addition. But that, I was at least pleased to see some directive around from the mayors and others that they were knowing they were going to have to put some money into this. I think now, obviously that's not, that's still in discussion, but anyway, I think it's important for us to know that those kinds of conversations have already started.
Yeah.
Thank you, Madam Chair.
Thank you. If I may just add one more comment, just following up on what you indicated in terms of the discussion, there was a comment made by city manager that these numbers, I'm showing totals for the region, they don't reflect necessarily a regional spending. What they reflect is the sum of what the cities are spending. So I think it starts a discussion. So at least it gets to a shared understanding of what is being spent by each individual jurisdiction and how do we develop a regional figure. So thank you.
And if I might just add, Madam Chair, an important question for us and for the region around implementation, how those, if dollars are raised in the name of the region or brought to the table in the name of the region, how does that get, how does that get worked out and pushed forward? Important questions for us as a regional body, I think. Thank you.
Thank you. Absolutely. We don't want to just keep throwing money on something that isn't working. We want to make sure that we're really targeting things that are working and make sure that the plans reflect that. So thank you so much for your feedback. Moving on to item number 9. We have Maggie Wong, research analyst from MAG, who will provide an update on Hand Up, the homelessness assets and needs data for unified planning map for information and input. So I'm handing it over to you, Maggie.
Thank you, Madam Chair. Can you all see my screen okay?
Yes.
Awesome. So yeah, thank you for introducing me. I'm happy to be here and share an update with you all on the new mapping tool we developed and shared a draft of last month. So we'll go ahead and start with the current status. So after we presented the draft map for feedback at the data subcommittee, the COC committee, and the board, we also had it sent out for stakeholder input and received a lot of really valuable feedback. So thank you so much to everyone who submitted comments, took the time to review, and shared suggestions and questions with us. It's been super helpful in making improvements to the data itself, as well as the interface and tool. So we've finished reviewing all the feedback and are working on getting the data updated with the comments. Big thanks to Ty and the HMIS 2-in-1 team as well for being a big part of the review process. So basically we're working on, what they did is they updated the 2-in-1 resource directories list of services that it's going to directly feed back into this tool. So now we're shifting focus to developing new features. So the next phase for this project is to fully develop it into a planning tool, which will be called Hand Up. It's quite a mouthful, but the homelessness asset and needs data for unified planning. So this will be a password protected website available to all providers and planners for regional planning around homelessness. Not only will it show the services and programs as it did in the draft tool, we'd also like to bring in additional data points and layers that will be useful for planning. And on the point of it being a password protected website, that really developed because of previous concerns around the need for additional messaging and logic before it becomes a public client-facing tool. So that might come at a later phase. The tentative timeline right now is for us to have a working draft of Hand Up in early May, so in the next few weeks. we'll definitely be sending it out for review as soon as it's ready. So the first thing that we want to add is a reporting function. So the idea behind this is that a user can select a specific geography and see an aggregate data summary of services available. Our thoughts are to include city and town, as well as zip code level summaries, along with a custom option where a user can draw their own boundary to look at a summary for that area. If there is interest, we are able to add other boundaries as well, such as legislative districts, but that just depends on interest. So definitely let us know if that's something that would be useful. We'll also make sure that the maps are printable for users. And these functions are things that we've developed previously for our interactive maps. I'll have a quick demo towards the end that shows what it looks like. So next, we'd also like to add additional services that would be relevant for planning. Right now, the map specifically visualizes programs and services targeted to people experiencing homelessness, but we thought of a few other general services, including transportation in the region, health facilities, libraries and parks, CAP offices, and coordinated entry points. So these previously were not included, but we're looking to bring them in for this next phase. We also want to bring in demographics from census data. The 4 main topics we've selected are poverty, median household income, minority population, and age. So when a user selects one of these topics, the idea is that the background map behind the location points will update to show one of these metrics by block group. So for example, an area with high poverty would be colored dark blue, and you could just look across the region to see where those areas are. Aside from census data, there are other contextual data layers we can bring in. So the unsheltered pit count and outreach data are examples of geographic data we've been collecting regularly in partnership with HMIS. So we can bring these in to show areas where people experiencing homelessness are frequently encountered. We also have unemployment and evictions data by zip code. And then 211 has also provided us with some call data by zip code, so we could visualize where people are asking for help accessing services. And finally, we also thought it could be interesting to bring in some HMIS data, specifically the zip code of last address, just to see how that matches up where services are located. So now I'm going to show a few examples of mapping, just showing that there are different ways to display the data. So this here is all 2020 outreach encounters by zip code. So the darkest blue areas are places where there were 750 or more outreach encounters, and then with the lighter blue showing areas with less. That's one example. This is the same data, but mapped by block group. And since block groups are a much smaller geography, you can see that this gets much more detailed with the specific areas where outreach is happening. And then this, again, is 2020 outreach data, but now this is a heat map. So it takes outreach concentrations within a 1 mile radius to show where the most outreach occurred in 2020. So those 3 maps were all the same data, but displayed in different ways. We're still exploring, which one would be the best option, but if anyone has any feedback or preference, definitely let us know. We want to be able to visualize this in a way that makes sense and is easy to understand. So now I'm going to shift real quick to a very quick demo of our statewide demographics viewer. It's one of the interactive data tools we've developed. So this takes census data for Arizona and just really provides an interactive way of looking at it spatially. So I'm going to zoom into Maricopa County and just show you a couple of its features. So right now you can see from the legend that this map is showing total population. But you can go into this maps tab and select a specific topic. So for example, if I were to select percent Hispanic, the map behind it refreshes, and now you can see the areas where there are higher concentrations of the population being Hispanic. So that's what we're thinking when we're bringing in the contextual data layers, is that on top of this, we'll have all the location points for services and programs, but behind it will be this contextual map of census data, unemployment data, evictions data, different ways to look at things together. And then I wanted to show the reporting function we developed. So here you can click standard report, and then you just select the specific geography you want to look at. So you can see that for our demographics viewer, we have quite a few options in terms of the type of geography. I'm just going to show Maricopa County as an example. So when you select that, it'll pull up, it's a little small to see here, my screen's a little small, but it's basically bringing up a summary tables for Maricopa County or whatever geography you selected for all the topics relevant for the census. So for the planning tool, we're thinking that this would be a summary of programs and services in the area. So that would be the 211 data along with the most recent housing inventory count data as well, the HIC data, to bring in the number of beds and units and programs in different geographic regions. So that wraps up my presentation. I'm pulling up some contact information if you want to reach out to either Nicole or I about this project. You can also send any feedback you have to COC staff and they'll make sure it gets back to us. But yeah, we're definitely really open to hearing any questions, comments, and feedback on how to make this tool useful for our community. Thank you.
Thank you so much, Maggie. That is such an awesome tool that we're going to have. Are there any comments from the board?
It's really neat. I love it.
Thanks, Ryan.
Awesome job.
We're excited to get this out there.
Yeah.
Anyone else? All right, hearing none. Thank you so much, Maggie. Great presentation. We'll go ahead and move on to item number 10, the updates from COC committees and subcommittees. So Maricopa Regional Continuum of Care Subcommittee chairs and members will provide an update on the recent activity from the COC work groups from Coordinated Entry, Racial Equity, Data Subcommittee, and the Emergency Solutions Grant Subcommittee. This item was requested as an ongoing agenda item by the COC board to remain informed about the work taking place in the various subcommittees. And we will start with the committee co-chair, Stephanie Smith. Then we will go to Matthew Kelly, then Data Subcommittee Co-Chair Jennifer Dangermond, and then ESG Subcommittee Chair Rachel Milne, and then lastly, Racial Equity Work Group Sam Jackson. Can we start with Stephanie Smith?
Thank you, Madam Co-Chair. At our last committee meeting, we received a lot of the same information that you guys got today, so I don't need to go over that. The one thing that we are working on, there is the Move On Strategy ad hoc group. So we've had our one meeting where we established our meeting frequency, our structure, who's going to be there, and our roles. So that'll get going. Other than that, I don't have much to report out on.
All right, thank you so much. And I believe we already heard Matthew Kelly, but does Matthew Kelly have more updates?
I can always talk more. So I just wanted to give a couple of additional updates because I think we spent a fair bit of time doing the operations manual and policy and procedures, and we spent a good 3 months doing that, and that's a rather tedious and time-consuming process. So now that we've actually done that, which was actually part of our racial equity plan, I wanted to give some updates on some things we're starting to move on. In our last meeting, we did receive a presentation from one of our technical assistants and also DES on the prevention system and going ahead and working to integrate that into the coordinated entry system. We're starting those conversations. We recognize that's probably going to take a little bit of time, but I wanted to acknowledge the fact that we've kind of started an ad hoc work group to start working on the process to build out how we're going to evaluate that, what's the system, who are the providers who are already doing prevention work, and getting them onboarded into the coordinated entry system and really making that move. So that's been started, but I don't have a ton to report on it just because it came out of the last meeting. One of the other things that we talked through in the last meeting was also the access point application. We kind of talked about that already. We reviewed the access point application as the committee and kind of gave some additional feedback to the leads with regards to that application, and the coordinated entry leads are actually getting together to update that document and represent that back to the coordinated entry subcommittee. And as part of that, we're going to be integrating some racial equity pieces into that scoring system as we move forward. The next thing that we also just started working on, which is progressive engagement. Really, as part of the policy and procedure discussion, when we got to progressive engagement, it was pretty clear that there were a number of individuals who had some concerns and wanted to look at making some changes to that overall system. So we have created an additional work group to kind of start working through that and talking about, I think a lot of the conversation in our last meeting focused around when individuals are timing out of their current rapid rehousing and we are looking that they still have ongoing needs. What are the options to go ahead and either A, extend that rapid rehousing and or B, find some alternate funding to actually allow them to remain in their housing for a longer period of time in an effort to maintain their stability. So that again, I want to preface, it's pretty early in the conversations, but I think it's kind of some important work that's being done and wanted to mention that. And then lastly, and I think probably most importantly, as you all know, within the racial equity plan, coordinated entry was specifically mentioned. So the first activity that was recommended as part of that plan was to update the policy and procedures to center on racial equity, which we have done at this point in time. So we're now going to be creating an ad hoc work group to discuss and review the VI SPDAT. Not only what do the current leads have as far as recommendations for either modifying and or changing to a different evaluation tool, but also kind of a, I think, system-wide or like more nationwide review of what other COCs have actually implemented, what changes they're making, and kind of evaluating whether or not that would make sense for our community. Rather than recreating the wheel, there might already be a really great model out there that we can potentially adopt. And also as part of that, we're looking at, of course, how we can go ahead and include individuals with lived experience in that process. So that's a really big aspect of that. Let's see here. And I think those are the major pieces that we're really looking at this point in time. It seemed when we brought up coordinated entry at the beginning of the call, there might be a lot of questions or concerns. I know, Tamara, you mentioned a couple of things, so I wanted to see if there was potentially any questions on any of the work. And I think also when I bring all this up, I want to make sure that the board is of the belief that we're moving in the correct direction and we're prioritizing our time appropriately, if that makes sense.
Thank you, Matthew. If you don't mind, we'll just save the questions for everybody at the end, if that works. And we'll move on to data subcommittee with Jennifer Dangermond.
Hello, thank you, Madam Chair. Like Stephanie said, a number of the items you've seen today come through data subcommittee before they move on to committee. So we did spend time on scorecard. We also have looked at a couple dashboards. That conversation is coming back up. If you've been in this work a long time, you know we have this dashboard conversation frequently. But it appears now a lot of things are sort of lining up and there's a lot of work going on, including the work kind of coming coordinated out of MAG that you've seen on a white paper about 3 months ago. That is how all the data sets are now starting to intersect with each other. So we're involved in a lot of that conversation, just really from a practical standpoint. There's a lot of providers at the table. So what makes sense, what's going over the line as far as data shares, what's too much, are all the agreements in place, that kind of thing to manage that data flow. There is also a subset of the data subcommittee working with the racial equity work with Jeff. And we've started having sort of overarching conversations about what people are doing with their data, but also starting to really elevate ideas about the intentionality of using our data to have an impact. So in that smaller subgroup, 2 ideas came up about one provider looking at their evictions by race, picking up, are any of those people that keep coming up Native American? Is maybe a good option, a referral somehow into NAC for support, so we can start to sort of build those cultural and racially matchy, more appropriate kind of capacity in our system. And we've also sort of looked at how can we do that on the family side maybe as well. We're not a family, NAC is not a family provider, but we have connections in that space. So really sort of looking at those ideas that we're taking from the data. And then also then how does this work that's being done get out into the public? A lot of our work is held within this structure. So how can we start publishing or pushing out the information, pushing out the ideas to greater audiences? And we're in the initial stages of looking at, maybe every third month or something, the data subcommittee meeting becomes a little bit more open. We stream or something so that people can actually hear some of the ideas that we're coming up with. And hopefully as that builds, they can see the ideas that we're really putting in place so that when we redo a scorecard, you can have measurable thresholds sort of building in that work, but also see how the whole system's involved. It's not just the COC funded providers, it's shelter, it's all these different pieces, and how we start to pull all that together. And always keeping in mind, we're about to go from not having any data to having lots of data, and how we communicate to everyone, what do all these different pieces mean? What do these different reports mean? How do they work? I'm really excited to see the slide on those funding opportunities. How do you take that then to the legislature? How do you take that data, tell the story into those funding circles so that we can bring in that whole package? And that's data. Thank you.
Thank you so much. And it looks like the ESG subcommittee chair, Rachel Milne, wasn't able to make it today. So we'll just go right ahead to racial equity work group, which is Samantha Jackson.
Thank you, Madam Chair. I appreciate it. So as a reminder on the race equity work, there are 4 priority areas: is coordinated entry, persons with lived experience, data, and workforce. And so thank you to everybody who has already given reports on coordinated entry and data. It's awesome. I appreciate it. Each of the areas has a lead person that is in place. And so we've all been kind of working on building out our work groups and working through the actionable items, which do have a timeline so that, those are kind of tracked responsibly. And then, building those kind of community partnerships, where we're able to collaborate and things like that. So there is a project management component to this work that is being done. We continue to meet with race equity partners. So I'm always grateful to Don and Jeff for their continuing efforts with us. Lived experience, Sarah Kent is overseeing a lot of the work that's happening in there. She has an awesome committee. They sent out surveys soliciting input from those that have lived experience, and they got 200 of those surveys back, which I think is incredible. So amazing there. They had their first meeting on the 23rd with, kind of a meet and greet amongst people that work in this area and have lived experience. So they discussed incentives, access, participating on webinars, access, technology issues. The regional strategies came up there as well. And they're planning a second meeting that should take place in a couple of weeks. TBD on details for that one. Matthew did an outstanding job on coordinated entry, especially on the policies and procedures piece of it. So thank you for representing that work. It is amazing to see some of this actually come to fruition and get implemented. Data, Jen mentioned some good things happening with data. Hillary's a part of that from the data subcommittee. She's a part of the race equity part of it as well. In terms of who's sitting on that team, and they've really been working through kind of I like to think of them like key performance indicators. So how are we going to measure, and track the work so that this race equity piece doesn't get lost in all of the amazing things that are coming about. And then last is that workforce side of it, which is me and Joanna. And we have yet to hold our first meeting, honestly, but it is going to come up in May. One of the things that we've been wanting to do is draft a statement of shared values that can be adopted amongst our partners. And we are working with the language that the COC board has been working on through their strategic efforts as well. We also want to identify which of our partners have kind of leadership, like targets kind of on leadership and board representation. So working through that piece of it. And then the trainings that have come with all of this race equity falls under the workforce piece of it. And that's sort of been an ongoing effort. And I'm, thanks to Julie, because she really drives this and makes it go. And then speaking of, Julie and I are presenting at the Housing Coalition's Race Equity and Housing webinar on Thursday as well. So that about does it for me.
Thank you so much. There's just so much great work happening in our community right now that like our agendas are so packed and everybody's got so much to say, so many updates. It's so amazing. Do any board members have any questions or comments for any of the subcommittee chairs and co-chairs? All right. Thank you so much, committee chair.
I do, Tamara.
Okay, go ahead.
So I feel stupid because I'm seeing this chat, which those of you who have been on Zooms with me, I chat probably too much. And I'm looking, I'm sending comments like to Sapna and Joanna, like, great job. And I'm realizing that everyone isn't everyone, right? It's just a handful of MAG staff. So I guess I'll stop chatting and I'll tell you what I was wanting to say. I'm amazed at our committee chairs. You are also intelligent and doing such amazing work. And I know how hard that is and what a commitment it is. So very, very good work. And you all will be hearing from me more in these meetings because I am officially done chatting since it's going really not to the people I intended to.
Thank you so much, Jackie. Yes, and thank you so much, chairs, for your hard work. The work happening at the committee level is outstanding.
Tamara, I had a question.
Sure.
This question's for Matthew, and thank all of you for agreeing to give us these updates. It's like Tamara said, it's really important to the board to hear from you because you guys are really doing the work and making all of these new things happen. So I'm hoping we can find the time to do that every month because I think it's really important for us to hear from you. But I did have a question, Matthew. One of the things that you mentioned was, I don't know if you said that DES had approached you or that, I'm not sure how you said it came up, but you said you were considering looking at prevention. And
well, we're not considering looking at prevention. We are looking at prevention for sure. So part of the HUD guidance is that prevention does need to be integrated into the coordinated entry system.
Okay,
so,
and by that, do you mean rental and utility assistance to prevent homelessness, or what's
correct.
your definition of prevention?
Yes.
Okay,
so go ahead. I'm sorry, Brian.
No, I was just going to say, one of the things I think you said was, it's new and you haven't necessarily made all of the contacts yet. And I was just going to invite you, Bruce Liggett, who's also on this board and call, and his team have been coalescing all of the CAP agencies, whether they be municipalities or mostly the municipal towns and cities who have been receiving big amounts of eviction prevention as a response to the pandemic. So we've all been getting more than ever before. And so Bruce has been getting us together weekly because we all want to make sure we're doing the very best job we can and that we're having a consistent response across the region so that we can be as effective as possible. So I thought maybe one of the inroads perhaps your committee could take is connecting up with Bruce and seeing if you could maybe present or somehow have an audience at one of those meetings so we could sort of get a feel for what you're trying to do and we could all be on the same page with you.
So yeah, that's great. And I think, Ryan, I think we're so early on in this process right now, we don't even have a clue as to what the overall system is going to look like. we know what the elements are that are required for that. And that's kind of what, you know, DES and the technical assistants came in to kind of give us the quick rundown of what other communities have done, but also now it's really up to us to kind of define what that actually is going to be. It's good to know that there's a group of people who are meeting already to talk about that, because I think as we look at developing something, I think we're going to want to probably A, bring that to them, and probably B, and ask for their input with regards to that, so that what we're attempting to implement also makes sense for the providers that are doing the work already. For sure.
Thank you.
Thank you.
All right, we're running a little short on time, so if you guys don't mind, I'm going to move us forward because we're already over time. So just wanted to see if there was a request for future agenda items. Do board members have any action or discussion items for future meetings? I know I would like to give sort of an overview of the Built for Zero dashboards and walk the board members through it so you guys can all see exactly how you can access dashboards for chronically homeless, veteran, families, and youth. We have all of them in the dashboards now.
Madam Chair, it's Eric. This may be self-evident. It may be obvious. We're going to go ahead and do it. But I think as I've spent time with the regional strategy process and the regional coordination group, it feels like we ought to have some conversation or like a time for implementation discussions, just because I think there's going to be, and I'm not saying we are going to, I don't think anybody's vision is that the MAG board, the Continuum Care Board is going to do everything, but I do think some thoughtful conversations around who's going to do what, and it may come out of the reports, but just a chance for us to look at that would be helpful, I think.
Great.
Thank you.
Thank you. All right. Hearing nothing else, moving on to item 12. And of course, if something comes to mind, you can always email myself, Ryan, and MAG staff. But for item 12, I did just want to announce, we're so excited to announce the newest addition to the Human Services team at MAG, Nikki Stevens. Nikki Stevens has accepted the position as the Regional Homelessness Program Manager and will be coming over to the MAG team on May 3rd. Woohoo! Go Nikki! That's great news. And so with that, great news. Is there anyone on the board that has any other announcements or events you would like to highlight? Okay, I just wanted to throw out there again that we do have our learning session May 18th, and the first, I think it's 500 people that register get swag. So if you want a Built for Zero swag bag, please search for Sarah Kent's email. She forwarded that invite to you, and anyone is welcome. So please join us for the learning session. Anything else? Oh, and I see Joan had to jump off, and so she had the legislative updates in her consent agenda and was hoping to give some more, but maybe that'll have to wait till next time. But if there's nothing else, we're 7 minutes over time, so maybe we adjourn. And thank you so much. Thank you everybody for your hard work. What amazing progress we've had in this community. So thank you so much, and I hope you all have a great day.
Bye, everyone.